It's great to be here. Just want to thank Bert and Eric for hosting us today, and we plan on doing this every day. It's 70 degrees in Farmington in March, where we're going to be here. Before we get started, I see Representative Mike D'Amico back there. I just want to say hello to him and thank him for coming out in support today. And this is truly a great day. We hope to be here for more of these events in Farmington and beyond. Today we're celebrating WellSpark, a company that has chosen to continue to grow in Connecticut, and they're going to hire just under 300 people over the next 7 years. And we just had a nice preview of their office and what that's going to look like as we get back to normal here post-COVID. But we're thrilled to welcome WellSpark. This is their home state, and realizing that they want to grow here as they build out their footprint nationally, it's really a testament to Connecticut and the quality of the jobs and the workforce that we have here in this state, especially as we get beyond COVID. Just quickly, I first met Bert and Eric, I think it was around 16 months ago in the Capitol, pre-COVID, and we talked about their business, and I got to learn a lot about this innovative homegrown company that they'll tell you more about. But the benefits of wellness, especially after COVID, I can't stress that enough. At the corporate and at the employer level, at the employee level, everyone wins, and this company is going to really do great things. So again, it's really great to be here. Thank you again, Bert, for choosing Connecticut to grow your company. With that, I'm going to pass it over to Eric, who runs Connecticut. Thank you.
Thank you, Commissioner, and welcome everybody. We're pleased that you're here today. WellSpark and Connecticut, you might be asking yourselves, what's the relationship there? WellSpark is a Connecticut company, and I'll give you a little bit of history about really both companies. First, Connecticut was founded back in 1981 by a group of doctors who wanted to give the residents of the state a different healthcare experience. And really, 40 years later, we continue to do what we did right from the very beginning. We're one of the leading health plans in the state. We employ over 650 people. And we have a long history of being deeply involved in the communities that both we live in and serve. But we also create jobs. We started as a very small company and have grown to the size that I just mentioned. One, for instance, is back in 1999 when Connecticut changed its corporate structure. The Connecticut Health Foundation was founded, and that foundation has continued to grow and help people all across the state. And while it's totally independent of Connecticut, if we hadn't restructured ourselves and provided capital to start that foundation, that may never have happened. But WellSpark grew in a little bit of a different way. And as Connecticut's president, one of the things that I do every day is think about how we can grow, how we can diversify our various businesses and really spread further out beyond the state of Connecticut. And one day, Bert, who was running all of our market efforts here in Connecticut, sales and marketing, she came and said, why don't we take the services that we provide in WellSpark and bring them all across the country. And as she shared that vision, I knew that she had a great idea and we were onto something big. So we had to do it. I'll let Bert tell a little bit more about WellSpark in a moment. But I think that it's a great Connecticut success story. Here are two companies that started here in Connecticut. They're run by Connecticut people. Bert and I are both Connecticut natives, UConn grads. And as leaders, we know that our decisions affect people in their lives. And we want to make sure that our passions for caring for our customers, developing our teams, and creating jobs stays right here at home in Connecticut. I'm so proud of what WellSpark has done and under Bert's leadership. I'll yield to Bert now to let her tell you a little bit more about the WellSpark business. Bert?
Thank you, Eric. Welcome, Governor, Commissioner. It's great to have you here, and also special welcome to State Rep Mike D'Amico. On behalf of my team, we're thrilled that you're all here. To say that I'm proud of what WellSpark is doing is an understatement. Now, I may have had the vision for this, but all the credit goes to my team for bringing it to life over the past 2 years. Many of them are out there, so this is our moment. WellSpark provides employers with programs that support the overall well-being of their workforce. And that support lies in our approach to health and acknowledges that health is more than physical. it must also include emotional well-being and mental and social health. We must also acknowledge that health is very personal. And at WellSpark, we help people get and stay healthy within the context of their unique life, their world, and what's going on in it. We give employees the tools they need to prevent chronic disease, or if they have been diagnosed, we give them the skills they need to stay on a good path. The bottom line is that a workforce needs to be healthy for a business to thrive, and we must acknowledge that every workforce is different. And that's where WellSpark does its best work. Let me give you a few facts about our company. We started with one customer in 2013, one customer right here in Connecticut. We now serve over 100 clients in Connecticut and beyond, and over 600,000 people have access to our programs. We're now in states like Michigan, New York, New Jersey, Alabama, bringing revenue from outside Connecticut to create jobs right here in our state. We recently signed a national deal with Healthy Trucking of America, a deal which is a game changer for our company. Not only will that put us in several more states, such as North Carolina, Arkansas, Arizona, and others, but it allows us to serve tens of thousands of long-haul professional drivers who have unique and complex health challenges. These drivers are a unique and hard-to-reach workforce, and we must reach them in a hard-to-reach workplace. Again, this is where WellSpark does its best work. In current times, many employers are finding that their employee benefits are no longer meeting the needs of their diverse workforces. Out-of-the-box programming no longer works for them, and clients are drawn to our new model of employee support. Our programs solve for the multiple business issues that are associated with the health of a workforce, such as healthcare costs, certainly, but also the cost of absenteeism related to illness, disability, and workers' compensation. We're seeing a tremendous interest in our programs, and we're growing rapidly. So this is WellSpark's world headquarters. We think big. This space will accommodate the additional team members we're hiring now and those who come over the next few years. We're moving into this beautiful space. We were moving into this beautiful space exactly 1 week, this week 1 year ago. And then we quickly went into a pandemic lockdown and we had to work remotely. So we're excited to finish the move. We have about 2/3 of our folks here, the other third in boxes, anxiously awaiting for the right time to return to work. So in summary, we see a future where Connecticut can be the nation's leader in wellness and healthy lifestyles, and we know we're a key part of that. So I want to thank Eric for believing in me, for my team, for believing in my vision. Eric, you're my boss, you're my banker, you're my friend. So thank you very much.
Hey, well said, Bert. Hey, just to the WellSpark people, I mean, it's wonderful to be working for a great company. It's great to be working for a company that's growing fast and successfully. But it's also great to be working for a company that's doing something really important and gives your life meaning and what a difference it makes. If I've appreciate that more than ever after this last year. You know, we just get the list from the CDC and comorbidities and COVID and you know, obesity. You know, Bert and I were just talking about that. Smoking. I mean, things that are preventable are the key dynamics when it comes to complications related to COVID. And as we were trying to think about how you prioritize people for vaccines, we realized it was, you know, half the population of the state of Connecticut had some type of a comorbidity in that category, smoking and obesity being near the top of that list, age being the number one factor. And you're making a difference there. And, you know, for that we're appreciative. Eric and I have spent some years talking about the high cost of healthcare and what we do about that. And, usually in the Capitol, it's who pays and, different people pay, and that will reduce costs. But what I love about what you're doing is we're dealing with the underlying costs of healthcare, and that's part of what Wellspark does as well. We've got a plan before the legislature that deals with the high cost of pharmaceuticals, especially the increases in costs and how we can cap that. Eric and I and some of the other insurance guys are thinking about preferred networks and how we can help bring down hospitalization costs. But as Wellspark knows, staying out of the hospital is the best way to do it, and that starts with public health, and that starts with what you're doing, either online. I saw what those new offices are going to be, in person, what that means to businesses. Nothing more important than having healthy persons be able to come out to work, not losing time for sick times, and what that means in terms of their related health care costs. For that, we are eternally grateful. And Eric and Bert, are really glad you're here in Connecticut, too. And stay right here. And my friend David Lehman, I think, has done an amazing job when it comes to how we grow companies right here in the state. We had more startups in the state of Connecticut last year, who would have thunk it, than ever before. And we changed a little bit the incentives. It used to be, here's a big grant, I hope you spend it well, and I hope things work out, and if not, we're going to have a problem. And now we have a partnership. And together, as Wellspark grows and adds on, maybe 300 employees over time, we grow with it. We give you incentives to do it. We give you the incentives to do it right here. And that's reason number 15. I'm here today with Wellspark and each and every one of you. Now more than ever, we really need you and what you're doing. And we're doing better on COVID. This warm spring day, I've said it before, our numbers continue to trend in the right direction. Overwhelmingly, the people most at risk, over 55, or that's where most of the comorbidities are vaccinated, or certainly will be vaccinated in the next 10 days, 2 weeks, as we continue to reopen. And but that doesn't mean get back out there, keep jogging, keep moving. I worked during the early days of COVID. We kept our parks open. We kept our beaches open. We got to create programs to make sure people realize now more than ever how important that is. And that's what Wellspark reminds us. Thanks, everybody.
Governor, thank you, and thank you for all your leadership during COVID. It's really, really appreciated. And Bert, Eric, once again, it's great to be here at the Global World Headquarters. I'm going to say that many, many times, but really appreciate everything you guys are doing. And thank everyone for coming out today. Happy to take any questions if there are any.
What kind of jobs are these? What kind of workers are you looking for?
Bert?
The question is, what kind of jobs are we looking for? Health coaches, nurse educators, data analysts. A lot of our programming starts with insights into a health profile of a group. So in broad strokes, that would be data, IT, but nursing, nurse education, and we are looking for credentials of someone that is really focused on that mind-body connection. So coaches with cognitive behavioral coaching credentials, as an example. But it's really comes down to nurses and health coaches, and we've had a great pipeline here in the state. We anticipated success, so we were bullish on that a couple of years ago, and we started to establish pipelines with the local colleges and some of the state universities around the state. And so we made connections on internship programs to get people in the pipeline early, and it's really paid off. We went right back to the pipeline when we got this new deal, and we found a ready supply of resources ready to step in.
And so it's 300 jobs over the next 7 years?
Yes.
And what is the average salary and how can people apply?
You can go to wellsparkhealth.com. There's a career site there. Average salary is 65 to 110 on average.
Can you elaborate on some of the employee support programs you're referencing when you were speaking? Just what exactly could people that work here be supported with?
We really have kind of 4 categories. So we're focused on chronic disease prevention and also if you have been diagnosed with a chronic disease, staying on a good path of self-management. As the governor said, our game, everybody talks about healthcare costs and the cost of pharmaceuticals, our game is to keep people out of the system to begin with. So we support employers, depending on where they are in their journey. We have really basic programs, like you want to offer a flu shot clinic and in exchange for an incentive. We have those, but really our core strength is in prevention. Diabetes prevention is one of our main programs. It's what we're doing for healthy trucking. We're certified by the CDC through 2023, and that is my team's doing. We had some great success with delivering results on prior programs. We also have a program we call Help 364, and it's for someone who has been diagnosed with a chronic disease and really needs some help and support in staying on a good path. And so this is where our coaches and our nurse educators come in to really help people understand their chronic disease and understand the impact of lifestyle on that chronic disease. And again, we're really trying to get underneath the physical and understand what is stopping that person from staying on a good path and taking care of themselves. Many times people take care of others before they take care of themselves. They're a caregiver. And so instead of just suggesting to that person that they need to take care of themselves, we take it the next step and say, we're going to help you find caregiving resources so that you can get at the root of the reason why you're not keeping yourself on a good path. So again, it's the multi-dimensions of a person's life for all of our programs that we're really trying to keep people on a good path of health, but help them with the things in their life that might be a barrier to that. And so those are the programs that we would offer to an employer.
Thank you very much.